Good afternoon, everybody. Let me firstly thank each and every one of you for the fabulous care that I see day in, day out as I walk around the site, as I get messages and emails from patients and their families. I've never ceased to be humbled by working alongside colleagues such as you. So thank you for that. I'm just going to cover two issues today. And talk about PPE and in particular impact on staff. And then secondly, I'm going to ask you to think about, I was going to say the future, but I'm going to talk about it's really about now. And how do we turn our attention back to those patients who are currently not being seen in the numbers that they need to be seen in? So those two issues. But let's talk about PPE first. It's a hot topic of conversation in the public, in the media, with our politicians. And of course, it's of great concern to ourselves and our staff. So without doubt, I think we would all feel this, which is we want our staff to be safe and feel safe. We want both. And both is really an important ingredient to supporting our staff to be the best that they can be. So let me just first talk about the being safe. And we have guidelines. We follow PHE and WHO guidelines that specify in good detail what situations demand what PPE. And it's really important that we follow those guidelines. It's not just about the supply of PPE, or that is a factor. It's really about making sure we're following good and proper infection control practices. That's what that's trying to get to us to do. And I think we're being pretty good at it. We know, and you've heard in the press, that there's a deep concern about the supply of PPE. And over recent weeks, we've experienced that ourselves. I've had a number of messages and emails from clinical teams expressing their anxiety about the availability of appropriate PPE for the situations that they face. And I understand that. I understand the anxiety. But let's just think about what's actually happened over recent weeks, and I'll just go through a bit of detail, which will be helpful, I think, for you. Firstly and foremostly, I think without doubt, this organisation has excelled because our clinicians and our procurement team and managers have worked together tirelessly 24/7 to make sure that we source for the right type and the right quantity of PPE. And increasingly, we're becoming more successful at that. But it has been down to that collaboration. And actually, and I'm going to call this out to, frankly, a fantastic procurement team who've gone way above and beyond what they were expected to do to help keep our patients and our staff safe. But let's look at some specifics. So firstly, visors. It was only a few weeks ago that there was a great concern expressed about the availability and the supply of visors. We now found ourselves in the position where we have a secure and stable supply of visors, and that's running at 10,000 per week. Now that should be enough to accommodate our needs. That's a real success. The situation for masks, FFP3 and 2, and surgical masks, great concern about those again. What we know is that we have significant stock. And if we follow PHE and WHO guidelines, we know that there should be enough for those members of staff who most need those masks. There has been an issue highlighted only yesterday again, where there are certain models of FFP3 that become not available to us because we are recipients of this stock as opposed to pulling that stock from the companies, recipients from the national system. And that's led to staff having to refit test so that they can be safe with those new models. Those surgical masks, again, we're getting to a good surgical and other protective masks, we're getting to a good place. against the guidelines for PHE and WHO. What we all know, though, that there's a deep area about gowns, concern about gowns. And what we have today is a situation where we actually have 2 to 3 days worth of stock of sterile and non-sterile gowns. And actually that's a better position than most organisations in the NHS to be in. We also respect our responsibilities to our nearby organisations, and we have supported nearby organisations with some stock of gowns to make sure that those NHS staff weren't placed at risk. And gowns are receiving particular attention both in the media, but I can assure you here in our own organisation, it's the centre of a lot of attention to make sure that we have a secure and reliable stock of gowns to keep our staff safe in the risks that they face. We know that it's not just about following the policy and the practice. It's not just about putting protective equipment in. It's about how we feel as individuals in situations that we face day in, day out. I've been out to our wards, departments, clinics. I've been out with our community staff in care homes and in patients' houses. And firstly, I can see the professionalism and the care and compassion that they give to every patient. It's great. However, I've heard very loudly and clearly the anxiety that staff feel when they're in situations where they believe there is greater risk to themselves and importantly to their families and friends. So what do we as leaders do about that in the situation that we are in at the moment? I think the first thing we must do is make sure that we've understood the risks and we put appropriate mitigations in for those risks. So we're in an enviable position where we have a clinical advisory group made up of clinicians, nurses, managers who assess the current guidance, assess the evidence base and provide us with policy and practice that keeps us safe. Included in that clinical advisory group are top-notch individuals in the relevant fields. So we have a consultant from the infectious diseases unit who works tirelessly day in, day out with that clinical advisory group to give us great advice on the situations that we face in practice, not just on paper. So we get to a good position where we can support staff with appropriate PPE and working practices. So understanding the risks, doing a risk assessment is always vital to any management and leadership role. So we must continue with that. The board will sign off a risk assessment on PPE hopefully on Monday, and we will be sharing that really deep and evidence-based risk assessment widely in the organisation, so you can see how the board itself is understanding those risks and reacting to those risks. Another thing we need to do is listen and listen to the concerns of our staff. So we do that, don't we, day in, day out, but we need to really actively work with our staff so that we can help them manage those anxieties. Often, a few words from people that they respect to their leaders is all that it takes to reassure staff. So really listen and work and talk with your staff as much as you can about this issue to ease their concerns. Really important. The third bit is more organisational wide, but important nevertheless. We need to improve our comms so that the messages and the policies are going out in a way that's usable for staff, and we will continually review those and improve those. And also, we are working with our staff side organisations, the trade unions and professional bodies, to ensure that we are listening to them and their concerns, their advice and support, so that we can get ourselves into a better place to manage the anxiety of staff. So those three things: risk, listening directly to your staff, comms and engagement with staff side organisations is the next big push for us in terms of how we will manage the anxiety around PPE. But we won't minimise the importance of having an adequate supply, and we will continue to work on that supply day in, day out. So there is some good news on PPE. We've increased the supply, but there's also good news on the pandemic. Firstly and foremostly, the patients that have been through your hands are doing well. We've now had over 400 patients discharged to their normal place of residence, whether that's home or nursing home, successfully after a bout of COVID and being managed by the people in our hospitals and community services. That's a tremendous result, and we often don't hear about the successes, do we, in the national media or locally. We talk about the concerns about the pandemic, but we can see, you know, increasing numbers of people being successfully cared for and having good outcomes. The other good news about the pandemic, and I think that's the right phrase to use in this, is that the expected surge and peak of COVID cases that require critical care, ITU support, is probably something like half of what we expected only 3 weeks ago. That's a really significant difference to our planning assumptions. However, what it now looks like, as advised by government, is that peak, albeit half of what we expected before, is likely to run at those levels, a few peaks and troughs, for many, many months. So our outlook has now changed from having a big peak and it coming down to a long spread of having to manage COVID patients. That's a trigger for us to think differently about how we're managing, I call them the non-COVID patients with all those other morbidities that require our care. And some really interesting stuff has happened during this period of time as we both prepared and we managed the COVID situation. So as you know, we've paused outpatients and our elective work for those patients that didn't need that emergency treatment. And during this time, what we've seen is many clinical teams applying innovative practices, ways, using technology in innovative ways to care for and manage those patients that they needed to keep safe, despite the fact that they couldn't see them either face to face or perhaps would have to see them over longer time periods. Some really remarkable changes and innovations that have been driven by the teams themselves, supported by, on occasion, the corporate infrastructure. But there's been some magic that's happened. And what I hear going around the organisation is people talking about those innovations, to the impact it's had on their patients, and really importantly, to the impact it's had on them and their working lives, and what they're expecting to happen into the future. And what they're expecting to happen into the future is not just simply to go back to the way things always were, was to actually grab hold of these innovations and make sure that they become part of our new way of working, our new NHS. It feels to me that we have a once-in-a-lifetime opportunity of grabbing hold of those innovations and making them part of our organisation, so that they're part of the new world that we enter into as we go into this 12 to 24 month period of managing COVID patients until a vaccine and other things come along to reduce that risk. We need to grab those innovations, grab those changes, and make sure they don't go away. So if we look at things like outpatients, we have seen some remarkable changes in the way that our clinicians want to manage that caseload in front of them, how they've used things like the telephone or video conferencing in very different ways, how they're working with GPs in very different ways to make sure patients are safe, get the treatment that they urgently need, and we can think about, and they think about how they're going to be managed into the future. So let's grab hold of those. Last week, we saw the introduction of the virtual hospital. Relatively slow burn at this moment in time, but we are seeing through that virtual hospital how our specialists can work directly with our GPs in care settings such as care homes to radically improve the outcome and the well-being of those patients in those care homes. It's a model that's often been talked about in the past, but the clinicians and the teams have stood those up in a matter of days and made them work. Terrific work that we should not let go of for our future. So today at our Thursday executive team meeting, the executive will be talking about and developing the method for how we'll go about capturing those innovations, planning to make them part of our new normal, so that we capture the benefits and the advantages that have come from those innovations. Equally important has been work that's already been going on to make sure that those patients that need urgent care can get that urgent care in a safe manner. So we've stood up a surgical capability in Rochdale Infirmary that will be used by patients from the footprint of the NCA, i.e. Salford, Oldham, Rochdale and Bury, and sometimes wider afield, to ensure they get their cancer surgery and urgent surgery in a timely fashion. It's one of a few facilities in the whole of the NHS that's been stood up in that way. We physically separated it from the main part of Rochdale Infirmary so that we can manage infection in a really, really strong and good way to protect those patients from coming to harm from infection. So we hope to improve the confidence of our patients in coming to us with those urgent cases and ensuring that we have the capacity to operate on them in an effective way. Similarly, we are working through how do we ensure that high acuity surgery that can only happen in Salford can come back and operate in a safe way. And that's an urgent piece of work that the executive and clinical teams are taking forward at this moment in time. Because what we need to think about as leaders, what we need to hold in our mind is not only how do we manage the impact of the pandemic, but also how do we move on from the pandemic to ensure that care for those other patients that need our services is delivered, but in a way that takes advantages of the innovations that we've seen during this emergency situation. So let me end by thanking you again for the great work that you're doing. And I'm sure I'll be thanking you in weeks and months to come about the great innovations that you've grabbed hold of and taken forward for the benefit of patients, but also staff. Thank you.